Hello everyone, I'm Dr. R. Morgan Davoudi from Atlantic Center for Plastic Cosmetic Surgery here in Atlanta. Today I thought we'd talk about abdominoplasty, and very briefly we're going to cover what are the options we're always asked about. And essentially we're going to talk about three different kinds of tummy tucks. We'll go from the very small one to the very large one, and then we'll talk about something right in the middle. So here's a depiction of an abdomen. Most plastic surgeons do conduct some liposuction on the sides here, so these are all commonly referred to as the flanks. So that gives you, of course, a better waistline and a judicious amount of liposuction here because of blood supply issues that we'll cover in other videos. So once the liposuction is over, now we're going to place the incision. The incision for many abdominoplasty is literally a C-section scar, or at least by definition that's what it should be. Essentially with that scar, because the length is short, it only allows a small amount of skin to be removed. And also plus or minus tightening the muscle on the lower portion. Mind you that on this procedure, we do not make an incision around the belly button so that you get to keep that natural looking belly button. We don't go above the belly button, no work is done above the belly button. So, which brings us to who's a good candidate for this sort of procedure would be someone that just has a small amount of skin, after pregnancy, and a small amount of muscle separation on the lower portion here. If you will, that small pooch that sometimes you see that goes from the belly button to the pubic area. The next thing that we're going to talk about is just a standard abdominoplasty. We call it a full abdominoplasty, but this is pretty much what you're going to get when you get a full abdominoplasty. And of course, a good candidate would be that someone that has skin looseness, a skin laxity above the belly button also. So that requires cutting around the belly button to be able to pull the entire skin down so that the laxity that's above the belly button is released. And also they'll give you an opportunity to get on the inside underneath the skin all the way to the breastbone to be able to tighten the muscles all the way from stem to the pubic hair. So typically when I discuss the scar with a patient, it's very important that it's placed very low on the pubic area because as the skin is pulled down, everything here gets pulled up also. We want a very, very small, static pubic area, and it all depends on how much hair we leave behind. The length of it, normally we just go from hip bone to hip bone. We never go around the patient, we never come up down the skin. Very, very rarely, if you have a weight loss patient with a lot of skin, do we extend the scars. I believe in keeping the scars very short and very low. They can be covered beautifully with a straight bathing suit. Most of our scars, by the way, are straight. They're not smiley faces, they're not zigzags, they're very even and they're very straight. So there's very amenable to covering with a bathing suit. Roughly about this much skin is removed, so you can see where the belly button is. So all the skin from the pubic area to about an inch or so above the belly button is removed. Then we go underneath. The muscles have separated from the pregnancy, and this picture depicts what it used to be before the separation. So you can get these six-pack muscles strengthened by working out, but you're never going to be able to bring them together because those are consequences of pregnancy with some ladies, of course, all right? So what we do, this gives us an opportunity to tighten the entire muscle from all the way, again, from the chest bone all the way to the pubic hair. That tightening is what flattens the abdomen, so there's no protrusion of the abdomen any longer. But most importantly, it gives the patients the curves that they're looking for. And that's the only way you're going to be able to accomplish that, to be able to tighten all those muscles. Finally, we close with every single suture inside. Belly button, since we did make an incision around it, is the most important part of the surgery. It's very important that this is closed naturally. Please visit our website. You'll see in our gallery many examples of this. It should look very, very natural because this is the telltale signs of an abdominoplasty. If it hasn't been done very naturally, it can be seen in a pool or the beach with a bathing suit. It's very noticeable and is a telltale sign of abdominoplasty. So that's your full abdominoplasty, or the standard abdominoplasty, if you will. The next one that we're going to talk about is the third one. This is what I call a modified abdominoplasty. This is the third type of abdominoplasty that we have. The good candidates for patients like this is that they have lower abdomen skin laxity, they have no laxity above the belly button, so there's no reason to cut around the belly button because there's no skin to be pulled, but the patient's muscles has separated from, again, from the chest bone all the way to the pubic hair. So it does require putting all the muscles edges back together. So therefore you need access to get up here somehow. This is what I call a modified abdominoplasty. Some people call it the umbilical float because, as you'll see by the design of how we do this, that's part of the procedure. Again, if I didn't say it with that full abdominoplasty, you start out with liposuction on the sides over here. The skin incision for the modified abdominoplasty, again, is about the same size of a C-section, or I'm sorry, a hysterectomy scar, a mini abdominoplasty scar, if you will. What happens is you lift the skin up like a hood of a car, you go up to the belly button. This is where it gets tricky. You cut the belly button from inside, so underneath the skin there's a stump where the belly button exits the abdomen, and so you cut that. So that allows you to get underneath, if you will, again using that hood of a car analogy, to get underneath the hood so you can get all the way up to this spot so you can do your muscle tightening. So again, this is a patient that's separated the muscle, whereas the diastasis all the way from the chest bone to the pubic hair, and you need to be able to get up here to be able to tighten that. So you get up here, you do the tightening that you have to do, and exactly like an abdominoplasty. On the way out, before you close the scar, which is about that big when you're done, you actually tack the belly button internally onto the muscle inside. So there are no scars around the belly button. It's your own natural belly button that's attached to your own skin, but it's placed at a slightly lower level than we found it, maybe about a ½ inch or exactly the spot that we found it in. Again, the only reason we severed the belly button is to give us access all the way to the top. You have to be a good candidate for this, which means that there's no laxity above the belly button, all the laxity is below. So these three are the highlights of the abdominoplasty that we offer over here. Hope that was helpful, and thank you for watching.